Okay, we are now going to demonstrate how to give a subcutaneous injection. You might be doing these at home with your pet, perhaps for arthritis, weekly pentastan injections, or for other reasons you might be needing to give injections at home. So we'll just run through some tips to make that as easy as possible. Firstly, if your injections have been given to you and you store them in the fridge, it's a good idea to get them out at least 10 minutes before you're going to use them, so that the liquid isn't too cold and the needle isn't too cold when you are giving it to your pet. The other thing, that if you've got a really sensitive pet, you might want to consider getting some numbing cream, also called Emla. You can get it from the pharmacy. You can pop just a little bit of it onto the skin, again probably 10 minutes before you're going to inject, and just that will help numb the skin up and they won't feel the needle going through as much. So once you've done those things, usually we send your injection home with a little stopper on the top, a sterile stopper, and a needle separately. So what you're going to need to do is pop that needle out of its wrapper, take your stopper off, and pop your syringe firmly onto that needle. You want it quite firm, because the last thing you want is that popping off and the fluid spraying everywhere when you go to inject. Then you need to take the cap off the needle so you're all ready to go. And I'll just demonstrate how to give it first. What I recommend you do is pull up a nice bit of skin, which is usually easiest around the neck of your pet. And what I suggest is you think about pulling it up and then going under your fingers, like going into a tent. If you inject directly through the skin, you'll often squirt it out on the other side. So try and think of going under your fingers into sort of a triangular tent area. Then you take your cap off, go at about a 45-degree angle. Through the skin you'll feel a little pop as it goes right through, and then just push your plunger in to give the injection. Simple as that.